Polymeric nanoparticles as drug delivery systems. Hello friends, I am very happy to meet you in this lecture series on polymeric nanoparticles. What are polymeric nanoparticles? Nanoparticles are colloidal dispersions or colloidal particles having a size range of 1 to 1000 nanometers. The polymeric nanoparticles are usually made up of biodegradable or very rarely non-biodegradable polymers. They may be of either synthetic or of natural source. Well friends, how these nanoparticles are classified? Basically, on the morphological structure, the nanoparticles are classified into two categories, namely nanospheres and nanocapsules. Nanospheres are made up of polymeric matrix systems in which the drug particles are uniformly dispersed. The rate of release of the drug from these polymeric matrix systems are controlled by the concentration of the polymer that we use for the manufacturing or preparing of the nanoparticles. The second one, nanocapsules. Nanocapsules, as the name indicates, it is made up of a drug core which is surrounded by a polymeric membrane. The release of the drug from these nanocapsules are controlled by the pores in the polymeric membrane. Thus, morphologically, the nanoparticles are classified into two, namely nanospheres and nanocapsules. Now let us discuss how these nanoparticles are superior over other drug delivery systems, particularly the novel drug delivery systems which already exist. What is the need for developing nanoparticles as a novel drug delivery system? Basically, the first and the most important thing is its specificity. The polymeric nanoparticles have a very superior specificity towards the target organ, tissues, or the cells, or even the cell organelles. Hence, the polymeric nanoparticles gets higher importance because of its superior targeting efficiency. This targeting efficiency is naturally contributed by the surface engineering or surface modification that can be made on the polymeric nanoparticles. Next, the nanoparticles, particularly polymeric nanoparticles, can act as a very good sustained or controlled drug delivery system which can release the drug very slowly in a controlled fashion over a long period of time. Either it may be nanosphere or let it be the nanocapsule. The concentration of the polymer and the pore size respectively will control the release of the drug from this drug delivery system. Next, I like to explain to you how these nanoparticles are better than the very closely related drug delivery system called microparticles. These microparticles basically have a issue like thromboembolization. That means when the drug containing microparticles are injected into the body, it will block the micro blood capillaries. That means the very fine capillaries, blood capillaries which supplies the blood to the tissues are blocked. Due to this blockade, the supply of the blood to the tissues and cells will be blocked, and thereby the cell death or tissue damage occurs. But the nanoparticles, as the name indicates, because of its fine particle size, they will not block the blood capillaries, and hence it does not possess a thromboembolization problem when it is injected into the body. Next, I like to emphasize the thixotropic property, which is superior to that of the microparticles. Basically, when we are trying to inject a suspension of microparticles into the body, we will come across with a blockade of the syringe needle due to the larger particle size of these microparticles. But this fine nanoparticles will not cause such blockades, and it travels very smoothly through the syringe needle. Next, I like to describe how these polymeric nanoparticles are little bit superior to that of your liposomes. Nowadays, liposomes also gaining lot of popularity because of its higher lipid content and permeability across the cell membranes. But they also encounter a lot of limitations and drawbacks. Among that, the major one is the presence of the lipid causes lipid degradation. Basically, liposomes are made up of lipid vesicles containing aqueous solutions in the core part, or in the center of the vesicle we can load the aqueous solution containing the drug. When these lipid molecules are continuously exposed to the aqueous solution, they may undergo degradation. The continuous exposure of the lipids to the aqueous solutions may cause degradation of the lipids, thereby cause leakage. The leakage of the aqueous solutions out of the vesicle happens. The another one important problem is it is with every lipid, when it is exposed to air and moisture, they may undergo rancidity, and thus the liposomes get degraded. But the polymeric nanoparticles are very strong and stable in these aspects. Thus, the nanoparticles, although they are smaller, they are stable and they have enhanced therapeutic efficacy when compared to other novel drug delivery systems.
The idea is that the nanotechnology enables diagnosis to get a lot better, diagnosis where it needs to be diagnosed, and it also gets a lot better in targeting drugs directly to the place where they need to go. Well, I think one of the beauties is to move nanotechnology more to the point of care end, or to the very end, where we are getting away from the one-size-fits-it-all of administering one drug, one oral drug that is supposed to treat something at the end of the foot, and that has a lot of systemic side effects while it moves through the body.
So the sort of thing you'd use is a shell, a hollow shell, where you've got molecules that self-assemble to form this hollow structure. Then the drug molecules you have to get in the middle. Now, you've got to get the shell to be robust, it's got to be physically robust so it doesn't break apart. It's got to have a coating on it that stops the body recognising it. And what you do for that is that you put a little layer of hairy molecules, like kind of hairy coat, that stops proteins sticking to it and stops the body recognising it in that way. These are called stealth liposomes, some of the ones that are used already, because they're kind of this stealth characteristic. The problem is to get a drug molecule, and the drug molecule is probably going to be very toxic, particularly if it's an anti-cancer drug. These are very nasty chemicals. You've got to get that chemical, you've got to get those molecules, you've got to wrap them up in a container, you've got to put them in the body, you've got to have that container not be recognised by the body's defence system, so it's got to slip through the defences unseen. And then when it gets to its target, it's got to be able to release the molecule so it can do its job. You'd like the vehicle to break up, releasing its payload when it gets to the place where it's needed. So, for example, an anti-cancer drug, when it gets to the tumour, you'd like it to break up there. And that could happen through a trigger like heat. So if the tumours are sometimes slightly hotter than their surroundings. So if you arranged it so that the heat made the vehicle break up, that would work. Another thing that people are trying is using light. So if you illuminated the tumour from outside with a laser, then that light could trigger the vehicle to break up. So there are quite a lot of different ways that you could try.
That is the very essence of nanotechnology. Only when you make them below a certain size and hit the nanometer range do the particles have a property that makes them unique in what they are.
Dear friends, in this lecture I had explained to you about what is nanoparticle, how it is classified, and what are the advantages or how this polymeric nanoparticles are superior to that of the existing novel drug delivery systems. In the forthcoming series of my lecture, you can understand how these nanoparticles can be used for targeting brain, very particularly across blood-brain barrier, as well as we can understand how these nanoparticles can be used for the treatment of cancer